Dr. Tyler LeBaron, welcome to the podcast. It would be an understatement to say I am starstruck. I am very thankful that you agreed to do this conversation. I feel like this has been a long time coming because I've been using molecular hydrogen for so long with my clients and my followers and my own journey. So thank you for coming on. I really appreciate it.
Oh, my pleasure. Absolutely. I mean, nothing makes me happier than to talk about molecular hydrogen.
Well, I first came across you in 2019 with my own health journey, and we'll touch a little bit on that. But your background is in biochemistry and then exercise and physiology. Why did you all of a sudden become interested in molecular hydrogen? Was it a study you came across? Like, what triggered that?
Yeah, so actually a combination of my studies because in the end I'm just passionate about health and wellness, exercise, performance, all these areas, but from a very young age, I was like in elementary school. And so I actually came across hydrogen back when I was first studying in the university, my very first semester basically, when and as you said, I graduated in biochemistry, but I came across an article in Nature Medicine, and that's one of the most prestigious, reputable, or credible journals that are out there. And
Hmm.
it showed that hydrogen had these therapeutic antioxidant-like effects. And this was really exciting to me at the time. And I thought, wow, like this is something really easy to administer. It's very interesting. It's novel. Like there's so many factors about it that I got interested then, and then went to Japan for my internship for my biochemistry degree, and I studied at Nagoya University in neurogenetics and researching hydrogen gas. And I got to meet a lot of other researchers, including the authors of the 2007 Nature Medicine publication, and really just learned like, wow, hydrogen is a serious field with serious, highly qualified academic researchers. And I decided I wanted to pursue this more. And so, yeah, later I did a master's in exercise physiology, exercise sciences, and then PhD in physiology, all researching molecular hydrogen. And I'm still been been involved in that, researching and collaborating with researchers all around the world. And so, yeah, I guess to answer your question, I mean, my studies have all been driven in large part trying to understand this very fascinating yet simple, complicated molecule.
Yeah, it's clearly your calling. Like we all have our calling, and you were lucky enough to find yours at a younger age. And as we mentioned before we even started recording, all of a sudden you're a star, like you're the face of molecular hydrogen.
Which is not, I mean, I guess it's subjective. I mean, I just want to be a messenger, really. I mean, hydrogen, it's interesting because hydrogen was the first molecule. I mean, it's the first element and then the first molecule in the universe, right? It's the first thing ever. And we don't often give a lot of attention to molecular hydrogen, but really it's the building block of everything. I mean, even all the rest of the periodic table of elements basically comes from hydrogen, right? Like the sun burns hydrogen in nuclear fusion, combining the nuclei to make helium, and then that continues to make all the other elements, right? It's the
Mm.
ancestor of everything. And now we're starting to realize that molecular hydrogen, this simple molecule, has these potentially foundational health promoting benefits, and it needs to have the awareness that it deserves. And so I'm just happy to be one of the messengers and to help to uncover some of the discoveries or learning things about molecular hydrogen. It's a very exciting path to be on.
Do you know what the earliest research was around hydrogen? Was it that study back in 2007, or have we kind of been looking at this in the 90s?
Yeah, actually, so we published a paper. Maybe you can put it in the show notes or
Mhm.
something. But we actually published two articles on the historical overview of hydrogen research, and it's very fascinating. But essentially, the earliest publication that we found on molecular hydrogen was back in 1793.
Whoa.
And yeah, so it's been looked at for actually a long time. But there's a little bit different though, because in that case, there was these doctors who were just basically inhaling every gas they get their hands on and trying all sorts of things. And one of them happened to be hydrogen gas,
Mm,
but they reported some had like some anti-inflammatory effects when you would inhale this gas for the lungs. And so it was very interesting. It was found way back then. And then there was a couple of articles every once in a while that published, every 10, 20, 30 years or so. And then maybe another article in 1975 was a pretty big article. It was published in Science, which is like the top journal also,
mm,
and it was actually done out of Texas A&M and Baylor University. And this was a hyperbaric hydrogen therapy. So they took these well, it was an anti-cancer treatment. So they took these rodents and they transplanted melanoma tumors inside of them, and so those tumors are just growing,
mm,
and they put them in this very high pressure uh, situation of hydrogen gas, and there was marked regression of the tumors. It was phenomenal. I mean, it was you just the results are just breathtaking,
mm,
but it didn't really catch on, probably because it's highly impractical to do a hyperbaric. And we're talking not like your hyperbaric oxygen, which is like, you know, just a little bit over atmospheric pressure, or maybe two or three times that at the most.
mm,
These levels were like they're like 10 like atmospheres or higher. I mean, very high levels of pressure. But it was not. So my point is not clinically relevant
mm,
for in a lot of ways. And so did not, a lot of research didn't really happen, but it was that 2007 article that really ignited, no pun intended, the hydrogen research. Because, and I'll just break this down real quick, that study. So in 2007, what the researchers did is they made a stroke model. So basically, they cut the blood supply to the brain, and that's going to cause like brain damage because you
mm,
don't have blood going to the brain.
mm,
That's what a stroke is, right? And then when they let the blood go back to the brain after an hour or so, then that causes more damage actually because you have all this oxygen-rich blood going to the brain, and that's called this reperfusion. So it's ischemia when there's no oxygen there, and there's reperfusion when all the oxygen-rich blood goes back, and it causes lots of free radicals and oxidative damage and so on. And it's a very major issue. It's this ischemia reperfusion injury.
mm,
Well, when they administered hydrogen gas via inhalation to these rats, and they used a very small amount. It was only 2%, 2.3% hydrogen gas or so in the study. And and this is important because this small amount of hydrogen gas is not flammable. I mean, you could light a match or a candle or something under
mm,
these conditions of hydrogen gas, and you would not have an explosion because the amount is so low. However, the inhalation of hydrogen gas like drastically reduced the brain damage from this stroke model. I mean, you can look at the images, you can just night and day difference. You can tell how big of a difference the hydrogen gas made from preventing the brain damage induced by this stroke
mm,
in this animal study. And then they took the hydrogen gas also and they dissolved it into the cell culture media and they added some different stressors and things, and they found that hydrogen gas exerted a very prominent antioxidant effect. So it protected the cells from this stressor, from oxidative damage and
mm,
another, cell apoptosis or cell suicide, cell death, right? And it was just really remarkable. So this study was landmark because it showed that you can take hydrogen gas and administer it in a clinically feasible, safe way and by dissolving it in the cell correlated too, showing mechanistically it does have these antioxidant-like effects, and finding specifically it could selectively target these hydroxyl radicals, which are the most dangerous or harmful free radicals there are. But it could selectively reduce these hydroxyl radicals, but it would not perturb or neutralize the beneficial free radicals because the body has a lot of important free radicals like nitric oxide or
mm,
superoxide. These are very important, and hydrogen gas wasn't neutralizing these, so it was selectively targeting the hydroxyl radical.
mm,
And that study, like I said, ignited the clinical research to where now there's around, well, I guess with clinical studies, around 200 or so human studies and upwards of over 3,000 publications in total on molecular hydrogen. So typically we refer to the 2007 paper as the landmark paper that
mm,
really got the research going. And of course, that was the paper that got me very interested in this as well.
mm. Am I correct in saying that that study is also the fuel behind Japanese hospitals using molecular hydrogen as a therapeutic.
Yeah, yeah, exactly. Because that study was happened in Japan, and the same idea with the use of the these hospitals in Japan using hydrogen inhalation. And just to clarify, it's not that the hydrogen inhalation is used in all these hospitals as a mainstream therapeutic, but rather that in order to do large scale clinical studies in
Hmm.
a hospital setting, you have to get government approval.
Hmm.
And that's a process. You have to have a lot of good data for safety, for efficacy, and all this in order to get those levels of approvals to do these studies. And the Japanese government did that, and they classified hydrogen as an emergency medicine, as a class 2B medical, class 2B medicine, basically.
Hmm.
So they could do this multi collaborative hospital study specifically on post cardiac arrest syndrome. And there's been a couple articles that have been published with this approval so far, with a similar with like the stroke idea, right? But this is post cardiac arrest syndrome, which is basically if you have a heart attack, you go to heart cardiac arrest, your heart stops. So
Hmm.
now your body, your brain, right, is not getting the blood and everything, the oxygen you need. So that's this ischemia portion. And then you do CPR or you revive the heart, and now you get the circulation going, but all that oxygen-rich blood goes back through the blood and the cells, and that's this reperfusion injury. And oftentimes when this happens, you get all this increased free radical or oxidative damage that occurs, inflammation, and all of these things. And so the survival following this post cardiac situation is quite low, and that's why it's called post cardiac arrest syndrome, right?
Hmm.
And typically in mainstream medicine, we use this targeted temperature management. And so if by for example maintaining a cooler body temperature, then you can drastically improve the survivability of the subjects, right? And so like in some the early animal studies, it was really impressive because they would use hydrogen gas and compare it head to head with the current therapeutics, right? And basically with I forget the numbers exactly, but we can put the studies in the show notes though. Essentially, without any therapy at all, with a post-cardiac arrest syndrome, the animals would have like a 43% survival. And then when you use the targeted temperature management, then the survival went up to around 70 something percent. So obviously a very big difference.
Yeah.
And about the same was true with hydrogen gas. It almost gave like nearly the exact same benefits of just providing hydrogen gas.
Yeah.
And then actually, when you combine the two together, there was 100% survival with both of these. And so there's these types of studies, and also another clinical study. It was let's see, it was 25 subjects in each group, but they there was a stroke situation, and half of them were giving hydrogen gas, and the other half was giving adarvone, which is an approved medical drug for stroke.
Hmm.
And they did the study, and basically hydrogen gas outperformed the drug on all parameters, right? So these types of preclinical research and early clinical studies is what ultimately got the approval to do these very large scale clinical studies in the hospitals, so we can really understand the clinical efficacy of hydrogen gas. And so far, the results are showing some really good promise.
Mm. It is powerful, and it's also encouraging to people that this is an option now, especially when we're going to get into like the hydrogen water aspect, which is more feasible for people because most people are not going to do hydrogen gas. But I'm just curious, for my own curiosity, have you heard of any other hospitals anywhere in the world that are looking at using molecular hydrogen or they're using hydrogen?
So again, with the hospital situation, there's every government has their regulations, right?
Yeah.
And so like when Japan, you can't just go to the hospital and you're going to be given hydrogen inhalation. You're going to be enrolled into the study if they're using it. There's like 20 hospitals or so that are part of this study, right? And then
Hmm.
everything has to be approved. Same thing here in the USA. There's no like studies that are sorry, there's no hospitals that are actively using hydrogen gas, but there are studies being conducted under the FDA's NDI, or no, IND, investigative new drug. And
Hmm.
so what these investigators, researchers can do is they can apply to the FDA. They can it's a whole bunch of paperwork, but you have to show safety, you have to show efficacy, and a number of different things, and then you can use a hydrogen gas in a hospital setting, so
Mhm.
you can determine if the use of hydrogen gas is clinically effective, and then it can get broader approval and so on. And that has been done. So the FDA has approved, several of these types of studies, and several of them have been published already, like a
Mhm.
phase 1 clinical study and of this nature. And then China, yeah, of course, I think it's more well known that China has really promoted inhalation of hydrogen gas, and in fact, it's actually been approved as a class 3 medical device as well, and it was one of the recommendations for the COVID-19. And so that's also catching on fire. Um,
Probably because of its inflammatory aspect.
Yeah, so yeah, exactly, because it helps with the anti-inflammatory, has anti-inflammatory effects, and a number of other issues with the cytokine storm,
Mhm.
and it's it's a safe way, and it's easy to administer, and it shows some of these potential benefits, and so the therapeutic index of hydrogen gas is really high. That's why you're able to get these approvals, why it can make sense to use it, but in the end, there's still no government agency that it has a fully approved hydrogen gas as a mainstream medical treatment or something. That really takes very large, very expensive studies in order to get there. And there's no major pharmaceutical company or something or some multi-billionaire philanthropist that says, "Hey, here's $1 billion to develop hydrogen gas as a drug
Mhm.
and take it all the way through all the approvals and everything that needs to happen in order to get the approval."
Mhm.
Because ultimately, that's what would need to happen in order to get that level of approval. And it could happen over time, right? Because more and more funding, government funding, is as well as industry funding, but a lot of government funding is going towards the researching hydrogen gas for its therapeutic potential.
Mm. So you're clearly an amazing resource of information. You must have a photographic memory that you just keep spouting and remembering all these studies. And I suppose hydrogen plays a part in your cognitive performance. But I know a lot of my clients and followers right now are saying, okay, this is all great and all, but what is molecular hydrogen?
Oh yeah, that we should have probably started with that because that's one of the biggest confusions. And we just have to go back to our elementary school and we think of the periodic table of elements, and hydrogen is number one, right? Hydrogen is the first one. It has one proton and one electron. And that hydrogen alone is just a hydrogen atom is not really found in nature very often just by itself because well, technically it's a free radical because it just has one electron, so that's called an unpaired electron. So it's really going to combine with something else really quickly. And
Mhm.
often it'll combine with something like oxygen. And if it does, if two hydrogens combine with oxygen, we call that water. Hydrogen, oxygen, hydrogen, right? So we have the H2O molecule. Or hydrogen can combine quickly with carbon, and that's where we form like your carbohydrates, right? Your pretty much everything is this carbon hydrogen bonds, right? Your
Mhm.
fats, your proteins, all the things we eat, trees, right? That's made of just your these types of carbohydrates, really what it is, right? It can combine with nitrogen, right? And so again, your amino groups. Anyway, hydrogen combines with pretty much everything, but it could also just combine with itself. So if hydrogen atom combines with another hydrogen atom to form a molecule, then we have a molecule of hydrogen. We call that molecular hydrogen. So
Mhm.
it has the chemical symbol of H2, which is the chemical formula, right? The two meaning there's two of these hydrogens. So H2, H2 gas. So that's what we're talking about. This is the same hydrogen gas that is explosive, that is being used as an alternative energy source, because if you combust hydrogen gas with oxygen gas together, then you get a fantastic explosion. A lot of energy is released and you just make water.
Mhm.
And this same hydrogen gas is also being shown to be therapeutic. And you can take the hydrogen gas and you can inhale it like we've been talking about, or you can dissolve it into water and then drink the water. And the water then becomes just like the carrier of the hydrogen gases dissolved in the water.
Mhm.
But and we call this hydrogen water. It's kind of can be confusing because hydrogen water, when people just hear that the first time, they're like, doesn't water already have hydrogen in it? Like, isn't water already H2O? It sounds like a scam or something, like right from the beginning when you say hydrogen water.
Mhm.
And that's because hydrogen water is a term. It's a scientific term that we use to describe just normal water, that's H2O, that contains dissolved hydrogen gas. But the hydrogen gas does not combine with the water molecule. It doesn't like make H3O or H4O or some other chemical structure or something. It's just dissolved in the water and it's just a gas. So it dissolves in the water and then if you let it sit out for a time, it's going to start coming out until eventually all the hydrogen gas has left the water. So when you put the water in, you put the hydrogen gas in the water, then you need to drink it soon enough so that you're getting that hydrogen gas. I mean, it's not going to like disappear immediately. It's not. You have to think about like carbonated beverages, right? You have the CO2, that's the CO2 gas that dissolves in the water, and you can now have carbonated water. And then you can drink that. And if you drink it within, half an hour or so, you're still getting that fizzy bubbles and everything from the CO2. In the same way with hydrogen gas, you dissolve that in the water and it's going to be there for, half an hour, depending on how, if it's fully dissolved or not. But it's not going to give you like that fizzy, bubbly like taste like carbonation does, because that's a different chemistry process. Because carbonation forms carbonic acid, and you have this whole equilibrium going on. Hydrogen gas doesn't do that. It just stays as the H2 molecule dissolved in the water. Doesn't change the actual taste or the chemistry of the water or anything. Just hydrogen gas alone. So that's what hydrogen is, and that's what hydrogen water is. Just water with hydrogen gas dissolved in it.
So I was telling you before we started recording that I either use hydrogen-rich water, their tablets, or I use Dr. Mercola's. I do prefer Dr. Mercola's, but when you drop it into the water, you can start to see it bubble or fizz up, that effervescent aspect, and then the water will go all cloudy. And ideally, and correct me if I'm wrong, but you want to drink it as fast as possible while it's still cloudy to get that concentration of hydrogen in it because it will escape into the atmosphere. It is a gas.
Yeah, that's right. And just to clarify, because there are several ways that you can make hydrogen water. I mean, you can literally take a tank of hydrogen gas and bubble it into the water. And that's how we initially did it with the research. We just dissolved and fused hydrogen gas into the water. And then there's electrolysis methods that can, decompose the water molecule to hydrogen gas and oxygen gas. And then there's this other method that you're talking about where you take a hydrogen producing tablet, you drop it in the water. It's like this effervescent type reaction, but what happens, these type of tablets, they contain magnesium. It's a special form of magnesium. It's metallic magnesium that reacts with the water to produce hydrogen gas and magnesium ions. And of course, we need the magnesium ions. But now you're making hydrogen gas. So all those bubbles that you're seeing, as you pointed out, that is the hydrogen.
Hmm.
So much hydrogen gas being produced, a lot of it cannot get dissolved in the water because it's already it's already full, it's already saturated with hydrogen gas. And so you start forming these micro and macro bubbles, and that's why it goes all cloudy. And this has been tested with gas chromatography with the tablets. What you'd have to do is it's best to typically drink the hydrogen water from the tablets when the tablet is dissolved and the water is still really cloudy. You get the most of the hydrogen gas. So we've used these tablets in clinical studies, and that's what we recommend because we base it off the data of the gas chromatography so we can determine when you're getting the highest dose of hydrogen. And that's typically as soon as that tablet dissolves and it floats to the top, you immediately start drinking it, and you're drinking with all the cloud there, so you're getting into your body, and you get the highest dose of hydrogen doing it that way. And this is like I said, we've done a number of clinical studies, and well, I have with some of my group, but a lot of other people have also used these in the clinical studies, just because it provides a consistent and high dose of hydrogen, and so it's an easy way to get molecular hydrogen. It's not the only way, obviously, but
Hmm.
it's an easy way.
Yeah, it is. It's feasible for most people. So when I'm making my hydrogen, and this is what I tell my people to do, and I've been doing this since day one because it just made sense to me. I have my clear glass so I can obviously see what the tablet's doing, room temperature water, and then I put some sort of glass lid on either a plate or a lunchbox. Now, I'm not delusional. I know some of the gas still gets out, but to slow down the loss of the gas, so then I'm eyeballing it. It's about 90 seconds for it all to dissolve. Still have my lid on it, and once I see that tablet has dissolved at the top, then I down it as fast as possible. And that's generally what I tell my clients to do is usually around 90 seconds room temperature,
Yeah.
but here just outside Calgary, like it gets really cold, like -40 cold. So you even room temperature is cold. And some mornings in the winter, I'm standing there for a good 4 minutes looking, going, come on, come on. It just takes forever. So note everyone, room temperature, normal room temperature is best. But that's how I get everyone. I
Yeah.
have a little YouTube video that I send to everyone. This is how you make it, and make sure you drink it as fast as possible.
Yeah, that's a good point because the it's really about that dissolution time because if the tablet dissolves really slow, then the rate of hydrogen gas being produced is about equaling the rate of hydrogen gas escaping. But but the kinetics of this reaction is really interesting, and if it can dissolve very quickly and make a lot of hydrogen gas, then it exceeds the rate of hydrogen gas escaping. And so having like a wide diameter vessel, a cup or something, and using room temperature water, so around 25 C degree water, then yeah, it's going to dissolve in around 90 seconds. So if it's not dissolving around, if it's taking you like 3 or 4 minutes, then you're missing a lot of hydrogen gas. It's better to use warmer water, and then you can get a higher amount of hydrogen gas from dissolving that tablet in there.
Yeah. So I wanted to discuss some of the therapeutic aspects. I know a big one on most of my client and followers' mind is the inflammation. That's primarily why I used it in the beginning. The very first time I used molecular hydrogen, I felt it instantly, like instantly. I always carry a lot of tension around my neck. I think most people do. But at this time in my life, I had a lot of tension and inflammation on my chest. And within seconds of swallowing the hydrogen water, I immediately felt a release on my chest, like that inflammation immediately released. And I know some people do feel it immediately, some people not at all, and we can get into that. But the inflammation really was a big factor for me. And I heard you originally speak with Dr. Mercola on the NRF2 and the even I think at the time you touched on like potential cancer aspects, which really intrigued me at the time. But the inflammation is a hot topic for all of my people. So can you speak on that a bit?
Yeah, absolutely. I think the nice thing about hydrogen and one of the reasons I'm so passionate about it is because it's not a strong anything. It's not a strong antioxidant that's going to neutralize everything because, like we talked about, we need some free radicals. And in the same way, it's not a strong, potent anti-inflammatory, which is important because we need inflammation. I mean, when you get infected, you get sick, you need a good inflammatory response so that you can get rid of the infection, the germs, right?
Hmm.
Bacteria, viruses, or what have you. And so if you're taking strong anti-inflammatories, that could be problematic. Even in terms of like exercise, when you exercise, you make inflammation. It's that inflammatory response that's going to in turn allow you to recover faster and get stronger and make improvements. And by blunting that inflammatory response by potent anti-inflammatories, we see clinically reductions in recovery and in benefits and so on. Hydrogen gas has anti-inflammatory effects because typically we see most people have chronic inflammation. But this issue is more of this inflammation dysregulation where they have chronic inflammation, chronic low-grade inflammation, so it's just constantly there all the time.
Hmm.
And then when they need the inflammation, it's a very slow response and maybe not as high as it needs to go. So it's dysregulated. That's really what the problem is. Well, hydrogen is this modulator. It's like it's an adaptogen, so to speak. And so it's going to modulate the inflammatory response. So this chronic inflammation that is just ongoing that you don't need, then hydrogen can come in and it can help to decrease that. And it does so through various pathways. That one, for example, is as it decreases the oxidative stress, well, that's going to decrease the inflammation because we know that oxidative stress is activates the inflammation. We know that, for example, if you have free radical production, it can activate TNF alpha, which is it's a transcription factor, and then TNF alpha in turn can activate NF kappa B, which is a transcription factor that promotes a whole bunch of pro-inflammatory cytokines. Well, hydrogen can decrease the oxidative stress, so now it's going to decrease TNF alpha activation and then decrease NFKB and then decrease everything else.
Mhm.
And then hydrogen also directly can influence things like NFKB by decreasing its activation.
Mhm.
You mentioned NRF2 earlier. NRF2 is our body's master antioxidant transcription factor regulator. Okay,
Mhm.
well, it turns out that when NRF2 is activated higher, NRF2 is able to suppress NFKB activation. So again, by increasing NRF2, you suppress NFKB, and then NFKB is not active or as active, then you don't have this chronic inflammation all the time because you're decreasing this amount. All right.
Mhm.
But that's just one transcription factor. Hydrogen is working on a whole bunch of different areas, like from like CFOS and uh, the various prostaglandins and COX enzymes, like all of these that promote inflammation. Hydrogen is able to modulate all of these, and really the goal is to bring things back into homeostasis to where we need to be.
Mhm.
And and as this modulator, that means it's not just unidirectional, where it's just decreasing say NFKB, sometimes we actually see that it can upregulate inflammation. Because again, remember, we want to have that acute early response so that we can
Mhm.
have a favorable response later on. And some of these studies have shown that hydrogen gas exerts very neuroprotective effects or whatever protective effect it is. But we see in the early stage, hydrogen actually activated or enhanced the activation of NFKB. We can see increases in interleukin 6, which is an inflammatory cytokine, and that's in the early stages. But then after a couple of hours, those levels go back down and they're lower than the other ones. And now we have a faster recovery and we have improved cell survival. And the whole organ or the animal or the human what is surviving better
Mhm.
because of this dual effect. So it's in some ways hydrogen in a lot of ways actually hydrogen works more on this principle of hormesis. So it's like it's a hormesis like molecule, which hormesis is basically just a small amount of a toxin ends up being beneficial for you.
Mhm.
And if you get too much, of course, then it's bad for you. Well, that's where hydrogen gas differs from most hormetic agents because most hormetic agents, a little bit of it, like exercise or some of the green vegetables that we eat, a lot of the therapeutics that are out there, they exert beneficial effects because it's like activating your cell survival and cell protective genes and proteins and enzymes. And then if they get too activated, well, then now it's causing cell death. It's causing harm, right?
Yeah.
Well, hydrogen gas is you increase the dose, well, sometimes we see more and more activation, but then there's just diminishing returns, and you don't actually see cell death. So that's where it differs from a typical hormesis, because you can obviously exercise too much. I mean, if you just, exercised all the time, then yeah, you're gonna get too much inflammation, free radical damage, and so many problems going on, right? So it's you don't want that. Well, hydrogen gas, there's not evidence that an excessive amount ends up being harmful. It's possible that getting too much, like, being exposed to it for 24/7 for days and days on end, that you just get diminishing effects, or maybe the benefits, aren't there anymore because you want to get like this intermittent or pulsing type of effect.
Mhm.
But at least there's no toxic effects that we've seen from any of the studies.
Would there potentially be bowel tolerance issues because of the magnesium, depending on how much you're taking in a day?
Yes, so when it comes to first, that's a good clarification. I'm only talking about hydrogen gas, just
Mhm.
the molecule itself. But absolutely, we have to consider how is hydrogen gas being administered?
Yeah.
Because if you're taking like hydrogen producing tablets, well, first off, that so it has magnesium in there, and you can that's going to be therapeutic just in general because most people are deficient in magnesium. I mean,
Mm.
we need 300 to 400 milligrams of magnesium. Most people are deficient in that, and actually, optimally, it would be ideal to have closer to maybe 700 milligrams of magnesium. So you'd probably want to take a few tablets a day just to be closer to the optimal range, and then to start being toxic. I mean, you're talking about having, over a gram or so of magnesium every single day,
Mm,
or probably more than that. But before it really starts to become this hypermagnesia, which could be, obviously harmful.
mm,
Um, or same with drinking water, right? If you're drinking just hydrogen water, obviously if you're drinking 10 20 liters of hydrogen water a day, that's way too much water, right? You can get water intoxication, and that would not be good for you. So those are the things that can be harmful, but
mm,
not the hydrogen molecule itself.
mm. It's interesting. You mentioning the water there reminded me of something. About 2 years ago, we had a crazy heat wave in Calgary, and I do train pretty hard, and I am known for pushing myself too hard when I shouldn't. And I know you probably do that too with your training. But I ended up, first time ever, I got hyponatremia and I just passed out.
Oh
And
wow.
as soon it was my own fault, lesson learned. It hasn't happened since. But the first thing I had when I woke up was the molecular hydrogen. I was like, give me some water with the hydrogen. I just need to get not only the magnesium in, but just get this inflammation down. And then, of course, I had a lot of electrolytes after that. But that actually, in the very beginning, when I started using hydrogen, I would do it every morning and every night. I had a high stress response at the time and I did have a lot of inflammation. Now I don't really, and I actually attribute that to molecular hydrogen because I still take a tablet every single morning. I rarely miss it. But that does bring me to the dosing aspect. I do have clients with severe chronic inflammation, like everything hurts all day, every day. Um, if, and I know this is only theoretical, if we were to recommend dosing of the tablets for something like that to help reduce that sort of pain and inflammation, are we looking at twice a day, 3 times a day, like split doses across the day?
Yeah, it's a good question, and we really need more research because the tablets have been quite helpful to drive more clinical research because, like I said, it provides a high and consistent dose. But most clinical studies are at a lower dose and a lower concentration. But that's because there hasn't been something available, right?
Hmm.
Like back when the clinical research first started happening, you were lucky if you could get even a 1 milligram per liter or 1 ppm hydrogen water and try to administer that to subjects. And yet we could see that there were benefits, but now doing some of those studies again with higher doses, like metabolic syndrome,
Hmm.
we see greater benefits. And so maybe getting this higher dose and higher concentration is a more effective way. But we need more clinical studies to really know. And so at this stage, in a lot of ways, people like you help to drive the research because if you're coming back to us researchers and saying, hey, based upon our clinical experience, it seems that patients don't really start getting better until they're receiving two or three of this hydrogen producing tablet, which equates to, this many milligrams of hydrogen. And then we sit back and like, okay, interesting. Let's do a clinical study on that and maybe compare different doses and try to figure out, what's going to be the best way. And collecting the data that that you are kind of gathering and observing is really important because doing a big clinical study costs a lot of money. And so we want to set up the clinical study the very best we can so
Hmm.
that we can learn the most, so that we can really ensure that we are able to answer the very questions that we have, right? And so based upon the clinical research and based upon these reports, like you're saying, and the animal studies, then yeah, I would say that sometimes it might make more sense to go up for these higher doses, and like in fact, the clinical study we did one on metabolic syndrome, but we were providing 3 tablets a day, so 1 tablet 3 times a day,
Hmm.
and so it's a very high dose of hydrogen. But the benefits were, they were substantial. It would have been interesting had we had more funding
Hmm.
to compare just 1 tablet, for example, versus three or one, two, three, four, or something like that. But it's just so much money and so much effort to
Hmm.
go into that. But I think we're on the right track. And there's no downside that we've seen even this in this clinical study because it was placebo controlled and they had the same amount of magnesium. I mean, it tasted the same. It produced CO2 gas instead of hydrogen gas, so that it even looked like it was the same. You couldn't tell the difference, right?
Yeah.
And in the end, the amount of adverse reactions was the same in each group. And you always have, adverse reactions because of the power of the placebo or nocebo effect, which we talk about in our certification course. Um,
Yeah.
but we always have those types of things, right?
Yeah.
But I'm just saying there wasn't any adverse effects, and so I would say, yeah, with your clients, if they're able to, then yeah, they could increase the tablets, to two or three or maybe even more. Sometimes I've taken as much as, like, I don't know, 5 or 7 or maybe even 10. I don't know.
But
Just
you're leaving at least an hour in between each to kind of clear out the tablet before, and then you're at a baseline again, and then you go again.
Yeah, I think it's a good approach. I mean, in reality, we don't really know,
Mhm.
and so it would be interesting. Like would it be better if you would just take a tablet every 15 minutes, or something? We don't really know. I mean, there's some data to your point that you want to clear out the hydrogen gas, reestablish homeostasis, and then you spike it again, just like with exercise. You're doing like intervals, right?
Mm.
And you're giving the spike, but um, we need to see that clinical data. We can't just base everything off of the mechanistic concepts.
So, watching the clock, and I have some things I just want to mention, but before we move on, the metabolic studies that you did, if I'm correct, there was influence there on fatty liver.
Yeah, that was one of the earlier studies, and so there's actually several of them. But there was a first one that I was involved in. It was an animal study, and we did a low and high concentration of hydrogen water, and the lower concentration didn't have any benefits actually, but the higher concentration did. And so this of course this was an important finding that it maybe in this case the NAFLD, or the non-alcoholic fatty liver disease,
Mhm.
was potentially dose dependent. And then I was involved with a clinical study, where we found that yes, hydrogen helped to reduce the fat accumulation in certain regions of interest in the liver. And you could look at this through a sophisticated MRI scan. You could directly look at the fat accumulation, and there was benefits there.
Mhm.
And then later we did a metabolic syndrome study, and we didn't look at liver fat specifically, but we did see reductions in body weight and body fat, and improvements in lipid parameters and so on. But then we also did another study though with NAFLD, and the results in this study didn't seem as favorable as what we did before. And we discussed the reasons why, potentially some of the reasons why in the article. But there's just still a lot of unanswered questions about this whole area that we need to investigate more.
Yeah. It Back to your point that you made a few minutes ago, it must be very helpful talking to practitioners or people like myself who have used this on clients or followers, and what we're seeing that maybe you either haven't seen or you haven't thought of before, which is where we first connected. I just messaged you saying maybe he'll see it, maybe he won't. And I just said, have you heard of molecular hydrogen being used topically? Um, and what my clients were doing, actually, two of them, they were using ground up molecular hydrogen, so basically powder. They would grind it in a pestle and they were applying it to herpes warts. And so they would apply it, and this is not an exaggeration, at night before going to bed, and by the next morning, the warts would be gone, completely gone. And I've had clients use it for like canker sores in their mouth, which actually is really efficacious. I don't know if you know this, but if you've canker sores in your mouth and you drink the molecular hydrogen when it's very cloudy, the canker sores will be gone the next morning, which is really amazing to me.
Yeah.
Another thing I personally noticed is with nausea, and I would put this down to, I mean, you can tell me what you think about this, but if I ever have nausea, I'll drink molecular hydrogen and it will get rid of it almost immediately. I would assume it is part of the endotoxins and inflammatory response in the gut there, but that's something that works like magic for me.
Oh, interesting. Yeah, well, to your point, yeah, this is all very interesting because it makes me think, like, if you're, of course, I'm always thinking about the placebo effect and the correlation causation
Hmm.
fallacy, and all these other things, right? But but it's still collecting all these stories, and sometimes I hear it from multiple sources because I have heard people take like the tablets as you're saying and grind it up and then apply it topically that they see some pretty good relief. And so when you have, I guess, strong claims like that,
Yeah.
and people are seeing this, it's a pretty good place to do a study, right? To do a placebo controlled study and then do some mechanistic work to understand, is it the inflammatory situation, or what else might be going on? And mechanistically, I could see some reasons why that could
Mm,
happen for sure. How it helps the body's immune system and a number of things.
mm,
Um, but yeah, it is important for us to gather this type of information because I'm not a medical doctor. I don't see patients. I don't treat patients or anything like that. I don't give medical advice. My main, I guess, expertise, or if I call it that, is more actually in the biochemistry area,
mm,
on the molecular level and thinking about how this works mechanistically. But
mm,
in reality, as I mentioned, just because we can talk about a mechanism or find a mechanism for why something works doesn't mean it actually works. We have to do the clinical research, the clinical study, and the things that drive and help with clinical research is getting like reports like you're just talking about, as well as and combining that with mechanisms, and these go hand in hand to make a strong, robust clinical study
mm.
design.
Or at least something to get you thinking, like, oh, I haven't heard that before. But there was
Yeah.
another client of mine. I think you'll find this interesting, and maybe this is something you did know of, but I wouldn't have known of it unless I worked with this client. She had a lot of systemic inflammation. Her body was pretty much breaking down. It was catabolic, and she had steel rods put out throughout her spine and her hips and even down through her legs. She just had a lot of steel in her body. And it was back in the early days where it was like, oh, I think you would benefit from molecular hydrogen. So she started taking it. But all of a sudden, she started breaking out in this rash and she started feeling really rubbish and nauseous, headaches, the whole lot. And I was like, well, there's no way that's molecular hydrogen. Like, that's the safest molecule there is. So I'm like looking at all these other things. And so she's like, no, I think it's the hydrogen. So lo and behold, we stopped the hydrogen and all the symptoms disappeared. So I, of course, go to PubMed and Google, and I'm looking like, what's the connection here? And I did come across a study now, and the name is lost, but I'm sure I could find it if you wanted to look at it. And it had mentioned how hydrogen can be reactive with steel and could break it down. And from what I seemed to uncover here was that the hydrogen was reacting with the steel rods in her body and it was breaking it down. And that was then almost being detoxified through her skin and through her bells and headache. And as soon as we stopped, everything stopped, like all these issues. So that was, I know you speak about safety a lot, and that the only thing, the only negative I've ever came across was that, and obviously people with steel bars going through their bodies, few and far between, but this did happen and it was amazing to kind of uncover.
Yeah, that is fascinating. I haven't heard that before. I guess, I would not want to dismiss her experience or anything, right? But we just think objectively, the same as you said, is there's no way that could be from molecular hydrogen. So
Mhm,
we're thinking of all the other ideas, right? And so if you're using the tablets, for example, then maybe one of the questions could there be some sort of a reaction to some of the organic acids in there? Could there be
mhm,
something with, what was her magnesium levels or something like that? And then, so maybe we could try a different type of hydrogen, like a hydrogen water with has nothing else, just pure hydrogen gas dissolved into pure water, so you can remove all other variables you possibly can, right, to see if
yeah.
there's something there. And then if there is something happening, then the question, because that's the first thing is first we need to develop the most simple experiments in a controlled way to verify the phenomena, because sometimes we jump into trying to explain the phenomena
Mhm,
without first verifying the phenomena is actually occurring, right?
mhm,
So now let's say we've actually verified the phenomena is occurring, then we can mechanistically try to understand what might be going on. I think what you might have been looking at is what's termed hydrogen embrittlement, and where hydrogen can basically penetrate, metal cylinders, and it does actually break them down because the hydrogen molecule, is able to kind of react with these metals, and it causes embrittlement and it breaks them down.
Mm,
And so it'd be interesting to look at the specific type of metal that's in her body to see what type of reactivity there could be. Look at, because we can look at the rate constants, and we can look at, how much reaction could actually be occurring, if any at all,
mm,
or if there could be other things, because there are people who just anecdotally, only anecdotally,
mm,
they when they take the hydrogen, they feel these adverse reactions, and but has not been enough of these types of sensitive people to do controlled studies on them to really determine, is it really the hydrogen, or was it just a nocebo effect, or
mm,
the correlation causation fallacy or something. So it would be interesting to pool a bunch of these people and then do a kind of robust, study with ethics approval, right, to really see if we can verify this phenomena occurring or not.
mm,
Because because then you start thinking about it like, when you eat a healthy diet of, fruits and vegetables with fibers, your bacteria metabolizes the hydrogen gas to produce up to liters of hydrogen gas every day.
mm,
Whereas taking a hydrogen producing tablet is only, 80 milliliters of hydrogen gas. It's not very much. Now, most of the hydrogen gas produced by the bacteria goes into the colon, and you don't actually get a lot into the blood and different things. But we could still measure, for example, not everybody produces hydrogen gas, because they don't have the right bacteria. People who have a healthy microbiome do have the right bacteria. But it would be interesting to take her, for this patient of yours, and measure her breath hydrogen production after eating a carbohydrate, fiber rich meal.
mm,
Maybe it's very low, but if it's
mm,
really high, then the question is, well, is it really the hydrogen? Or maybe if we had her inhale hydrogen gas, does she have the same reaction or not? And
mm,
that still doesn't necessarily say it's not the hydrogen, because the way the hydrogen gas interacts with the stomach and the liver and different things is different from hydrogen water.
mm.
So there could still be something going on there, but there's actually quite a number of steps we could go through to really hone down what might be really going on.
Yeah, super interesting. Maybe that is a study in the future. Let's see what's happening with people who have a lot of steel in their body, and if there is a reaction even there with the steel. But that was interesting to me. I thought you would find it
Yeah, no,
interesting.
that is interesting. Yeah, I'd be curious to, I don't know if you're still in contact with her. Maybe we can try a couple of things, just to
I
see.
am, and even the hydrogen producing bacteria, I would guess she doesn't have a lot knowing nutrition tendencies. So, I mean, have been anything. You're correct, but I was just, at the time for me, of course, I'm not in a lab and I'm like, oh no, what's going on here?
Well,
So,
the first thing is do no harm, right? And so
mm,
if it's something easy, and you can say, okay, if you take this seems to happen. If you stop it, then it still goes away. Even if it's just in the mind or just a correlation thing, you don't want to do any harm. It's always better to, to not do things unless we have really strong clinical evidence that you really need to do this thing. And that's when it comes to, like, antibiotics, for example. There are, in my opinion, certain cases where it makes sense to take antibiotics.
mhm,
Generally, you don't want to do that, right? But sometimes maybe it's a good idea,
yeah.
and you have and the pros and cons are weighted. And but with hydrogen gas, we're still in these early stages where there's not super strong clinical evidence that you absolutely, regardless of anything, you absolutely have to take this. So it's just a safer approach to remove it, so you don't have those. Yeah.
So, one last question because we've hit our time, and I want to ask you because everyone's going to ask, what do you think of these hydrogen bottles, the hydrogen water bottles? So, my favorite is the tablets. I just feel they're more efficacious. They're easier for people. We can, to some extent, control concentration there. But Amazon, probably not the best place to buy a hydrogen bottle, but people do it. So, what's your opinion on those?
Well, I mean, I think they can be a suitable way, but just like with all products, sometimes people just grab a bottle, throw it on there, and there's no indication of whether or not it's actually providing any hydrogen gas. There are bottles out there, and I've tested them, where there's no detectable levels of hydrogen. Like, it's doing electrolysis, but it's maybe there's not a membrane in there, maybe it's not the right membrane, or number of different issues that are going on. So yes, you can see the gas, you can see pretty lights, but that doesn't mean there's actually hydrogen gas. And so if you do choose to do the bottle, then you want to make sure that at least it is certified to the IHSA criteria. And you can just contact the manufacturer and you can see if it has if been certified by H2 Analytics or another entity to the IHSA criteria. On our website, molecularhydrogeninstitute.org, there's an article that gives you a list of considerations you can think about when you're considering to try a hydrogen product if you want to. We don't give a list of products or recommendations. We don't promote or endorse any products, but we do give some considerations when you're looking at that. So I do have a couple of bottles that I use from time to time. So it is a viable option because sometimes the tablet you have to drink it really fast before you lose a lot of the hydrogen gas. It does change the taste a little bit. Sometimes you just want get good old hydrogen water without any taste or something. And so the bottles could potentially be a viable solution for those people. And you could have as many bottles as you want, right? Versus the tablet using another tablet every single time.
Mhm.
The problem is finding the right bottle. And number two, what is the longevity of that bottle? Because is it going to break down after 3 months, 6 months, 3 days? What is it? And then you have to buy another one. And so there's a lot of subjective things that really go into to play with all of this. And I just feel very fortunate in my situation that people send me products all the time,
Mhm.
and so I have a plethora of things to choose from, and I don't need to worry about, oh, I just wasted another several $100s on this bottle that doesn't work anymore or whatever it is, right? So in the end, yes, they can work, but you probably should ensure it reaches this minimum criteria. And even if a bottle doesn't have that, doesn't mean it's totally bogus. It's just there's not a lot of ways to really know independently, and that's just one of the guiding principles.
Mm. And they're not cheap. Like the really efficacious ones, probably the ones you've been sent, they're not cheap. So if it only works for 3 months and you've paid $500 for it, now you have to go pay another $500 for one. So,
Yeah, and it's good to know the company too, because like some of the companies, yeah, you might, if it's $500 or whatever it is, well, what are you gonna do if you can't ever talk to the company again, right? Or they're not gonna honor their warranty, right? So there's a lot of, again, we kind of talk about some of this in our evaluations, right? Because like this is a new market, so I do have grace for the good companies out there that are trying to come out with I like the it's a great idea. The bottle is a great idea, right? And so if a company's trying to do the right thing and they're honoring their warranty, they're talking to their customers, they're helping them, then they can get a replacement or whatever it is, then that's great. But just to like sell it and then not have any customer support after that, that's when it's kind of, resembles a scam.
yeah, yeah. Unfortunately, there is a lot nowadays out there, and probably why I preference the tablets as well. And I don't mind the taste at all.
Yeah, I don't either. And they're consistent. We use them in our research typically because you get a consistent high dose of hydrogen.
Mhm. So, Tyler, thank you for your time. This has been amazing. I hope you found it interesting too with my little tidbits there. And if I come across anything crazy again, I'll be sure to let you know.
Yeah, no, my pleasure also. And I want to say thank you again for supporting all the research and these efforts and bringing the mission of MHI, right, of education, research, and awareness. And you're one of the earlier ones to get certified as well through our institute. And so anyway, I just want to say thank you
I
for.
am I'm almost as excited about hydrogen as you are. In the very beginning, I did the first certificate, then I did the second, then I did the third, and then you brought out the new one and I did that. And it's a different world that excites me. So thank you for doing it because this is information people do need to know. We need to have all the options we can.
Yeah, absolutely. Well, my pleasure, and thank you again so much, and looking forward to talking again soon.
Thank you, Tyler. You have a great day and we'll chat soon.
All right, yep, we'll see you. Okay.